Good morning in the United States, good evening in India, and namaste to everyone around the world. My name is Sagar, and I welcome you to this webinar called Investing in Integrative Healthcare, hosted by the American Academy of Yoga and Meditation. I'd like to give a quick introduction here about what the American Academy of Yoga and Meditation is. AAYM, as it is also known, is a nonprofit organization for physicians, researchers, medical professionals, and practitioners of yoga and meditation dedicated to education and research by fostering an approach by linking science, arts, ethics, and spiritualism to improve ways of human life. Today, we will learn more about investing in integrative healthcare. According to the Center of Medicare and Medicaid Services, Americans spent almost $3.6 trillion in investing healthcare. Today, we will listen to some very well-educated speakers on the topic of investments in integrative healthcare. Our first speaker, Dr. Benjamin Kligler, is an executive director of Office of Patient-Centered Care. He is also the founding medical director of the Quantum Center for Health and Healing. Our second speaker, Dr. Marian Levy, is an Associate Dean Professor and is part of the School of Public Governing Council. Our last speaker, Dr. Indranil Basue, is a cardiologist and cardiac electrophysiologist. He is also the chairman of AAYM, the organization presenting this webinar series. And now, I would like to introduce our moderator, Dr. Seetharaman Mahadevanji. Dr. Mahadevan is the Duke Integrative Healthcare leader and is involved in promoting Ayurveda and yoga through Ayush Living. He is also an Ayurvedic health and nutrition consultant and a certified yoga teacher by Yoga Alliance International. Besides holding a PhD in medicinal chemistry from the University of Minnesota, he has done postdoctoral research at the Cleveland Clinic Learner Research Foundation. He also serves on the boards of American Academy of Yoga and Meditation, American Association of Ayurvedic Physicians, and the Council for Ayurveda Research. It is a pleasure to have you all with us today. Once again, I would like to welcome all of our viewers around the world to this wonderful discussion, and I will now pass it on to Dr. Mahadevan to lead the discussion. Namaste.
Namaste, everyone, and thank you, Sagar, for the wonderful introduction. Without much ado, let's get started. Let me introduce the first speaker today for our webinar on investing in integrative healthcare, Dr. Ben Kligler. Dr. Kligler is the executive director of the Office for Patient-Centered Care and Cultural Transformation for the Veterans Health Administration. He is the professor of family and community medicine at the Icahn School of Medicine at Mount Sinai and past chair of the Consortium of Academic Health Centers for Integrative Medicine. Dr. Kligler was also the founding medical director of the Center for Health and Healing and Integrative Medicine practice, which opened in 2000. Dr. Kligler is the author of The Curriculum in Complementary Therapeutics, a guide for the medical educator and co-editor of Integrative Medicine, Principles for Practice, a textbook published by McGraw-Hill. He is also the co-editor-in-chief of the peer-reviewed journal Explore, the Journal of Science and Healing. So let's hear the initial remarks and presentation by Dr. Ben Kligler.
Thank you. I'm very glad to be here today to talk to you about integrative health and especially to talk to you a little bit about how we are approaching this in the Veterans Health Administration. So in the Veterans Health Administration, which in case you're not aware is a large national health system that cares for folks who have been in the military service in the United States. It's about 140 medical centers around the country. We have roughly 6 million patients. So across the system, we are doing integrative healthcare under a name that we call whole health. And here you can see the definition of whole health, an approach to healthcare that empowers and equips people to take charge of their health and well-being and live their life to the fullest. The idea is that health systems have to be good at managing disease, preventing disease in a conventional sense, but they can do more than that. They can actually also be good at helping people build health and promote well-being in their lives. And in order to do that, the best way, we think, is to help people identify what is most important to them in their life, what matters to them the most, and then help build their treatment plan around this. And the idea is taking this kind of proactive approach can help people who already have established disease, but can also help prevent the development of advanced disease, which ultimately will be very costly and difficult for the person to deal with. If we can get a person more involved in their own healthcare, doing self-care and self-management early on. So that's the idea behind whole health in the Veterans Health Administration. And the complementary integrative health approaches, including yoga, play a very important part of that, and I'll be saying more about that. So why should we be doing integrative health? And this may not be news to people who are listening, but the evidence for the impact of integrative health approaches on particularly chronic pain has grown just astronomically over the course of the last 5 to 10 years, to the point where we now have a number of conventional clinical practice guidelines from mainstream medical groups like the American College of Physicians that really put integrative approaches like yoga in the first line of treatment for chronic pain. So just to focus in on one of the recommendations from that set of guidelines, which came out, I believe, in 2017, for patients with chronic low back pain, which is one of the most common causes of pain, as you know, clinicians and patients should initially select non-pharmacological treatment, exercise, multidisciplinary rehab, and then you can see in bold the integrative approaches that are also included: acupuncture, mindfulness-based stress reduction, tai chi, yoga, etc. So the idea is, according to these mainstream US physician groups, therapies like yoga are now actually first-line therapy before medication for the treatment and management of chronic low back pain. This is not something that was the case 10 years ago. These guidelines had not been published. The evidence base had not achieved the level that's required for guidelines like this to go into effect. Now, it's still very easy for physicians to prescribe medication. It's sometimes harder for them to manage to remember to send a patient for yoga or for acupuncture. So we still have a way to go in terms of implementing this. But the fact that this is now part of the what you would call standard of care for management of chronic pain is really, really helpful. There are more studies than just the American College of Physicians. This is a review from the National Center for Complementary Integrative Health at the National Institutes of Health on what is known about the evidence for complementary and integrative therapies for specific conditions. And here again, you can see in front of you acupuncture and yoga for back pain, acupuncture and tai chi for osteoarthritis of the knee, and you can see the rest. And this was published in a prominent journal, the Mayo Clinic Proceedings, a couple of years ago. So again, you can see that across the board, the medical literature is now very strongly supporting the use of many of these complementary therapies, particularly for pain. Now, they're not only useful for pain, they are potentially useful for many other different conditions, but a lot of the application is for pain. So let me flip now for a minute to talk about the VA. The VA health system has taken a very bold and progressive move. And as of 2017, the health system made a policy decision to actually include evidence-based complementary and integrative health approaches in the standard medical benefits package. So veterans who use the VA for care have a standard set of medical benefits that's covered as part of that care. And this policy, when it came into place, expanded the coverage for standard therapies to include a number of complementary therapies. The requirement was that these therapies have sufficient published evidence of effectiveness to justify them being included in the medical benefits package. And you can see in front of you now the therapies that are currently covered: acupuncture, tai chi, yoga, meditation, massage therapy, guided imagery, hypnosis, biofeedback. Chiropractic care has been part of VA care for about 15 years. That was mandated separately around 2005. So these therapies, basically what this means is that a veteran anywhere in the country, let's say someone with back pain who goes to see their provider, can expect that if their provider thinks that acupuncture or yoga might be the best approach for them, that they will be able to receive those services and have them paid for by their coverage. So in other words, not have to pay out of pocket. And this is a really tremendous breakthrough, because for most people in the United States, even those who have a health insurance, if they want to access acupuncture or massage therapy, many of them have to pay out of pocket because it will not be covered by their insurance. Now, this is changing gradually, and more private insurance companies are covering things like acupuncture. But the VA has really stepped out in front in terms of what other health systems and other payers are covering, and has moved to really bring these things into integration with the mainstream. This is a very exciting development, and we're really seeing a lot of amazing outcomes as a result in the VA, and a lot of outcomes where people who have chronic disease, or who have the risk for chronic disease or chronic pain, are able to take on some of these approaches, yoga being a great example, and help fend off the development of more chronic serious medical conditions. So these approaches are both useful for treatment of established conditions, but also for promoting overall well-being in a way which will help people avoid the development of these chronic and expensive conditions. Let me give you a few examples, and these are not just from inside the VA. Some of them are inside, some are outside. This is a study that was done a number of years ago, but a beautiful study of an older population who were taught mindfulness-based stress reduction, mindfulness meditation. And basically what this study showed, this was an 8-week course of meditation, very widely available and standardized. And it showed a number of things. These were patients with low back pain. First of all, it showed that their pain acceptance improved, so they were much better equipped to kind of live with whatever pain they had. But then if you look at the last bullet there, half of these patients reported a reduction in pain and sleep medications even 3 months after the study ended. So first of all, they learned the meditation, 8-week course, but then they continued to do it afterwards, because many people say, oh, people will never keep doing it. The fact is, people will. And then second of all, this group of people was able to cut back on medications, which particularly in older people can cause significant complications. Sleep medications, for example, are responsible for a lot of falls in older people because they're drowsy. And the ability to reduce those by giving them a self-management skill ultimately is a way to prevent things that are going to be very difficult and expensive in the long run. For example, you might have prevented a hip fracture in this population by cutting down or removing the necessity for a sleep medication. So there's a lot of potential here to give people skills that can ultimately help them stay healthy much longer. Here's another example of something that's very widespread in the VA, very simple and inexpensive to deliver. And this is a acupuncture technique that was specifically developed in the Air Force called battlefield acupuncture. So it is not full acupuncture. It is just 5 points on each ear. And it was developed for management of pain. And the idea is that because it's just 5 points on each ear, you do not need a fully trained and credentialed licensed acupuncturist or physician acupuncturist to deliver this treatment. So in VA so far, we have actually trained 5,000 clinicians in various categories: physical therapy, nursing, physicians, nurse practitioners, to do this battlefield acupuncture treatment. And what we see when this is delivered to veterans is very significant immediate pain relief. So a drop of 2 points on the pain scale. And for veterans with the most severe pain, we see even a higher drop in their pain score. So this is not perhaps as effective as a full comprehensive acupuncture treatment delivered by a fully trained clinician. But at the same time, the fact that we have 5,000 people around the VA trained to provide this therapy means it's actually very widely accessible to veterans as a routine part of their care. So this is another way that bringing in some of the integrative approaches has the potential to avoid, let's say, going on an opioid or going on another medication that might have significant complications attached. So yoga is actually extremely popular with veterans and has become a really central part of our program. I think one of the most important things about yoga is it's something that people can learn from a teacher or in a class, but then can continue to do on their own. And in fact, many, many veterans have taken that yoga class through the VA and then have continued to do it on their own. We see this especially now during the pandemic, when a lot of services in the VA have been converted from in-person services to virtual services. And one of the best examples of that is actually yoga. So we have data now from the VA showing that what we call tele-yoga, or yoga delivered by telehealth or a virtual platform, is just as effective for treatment of low back pain in veterans as in-person yoga, and that the levels of satisfaction from veterans are just as high. In some cases, they're even higher because they prefer to do this from their own home as opposed to having to travel and find a parking spot and go through traffic. So doing it from home for some people actually is preferable. So this slide just summarizes some of the evidence for yoga, which I'm sure many of you are familiar with. Very effective in treatment of low back pain, can also be very effective for a number of mental health conditions, including depression and anxiety, may be very helpful with sleep problems, which, as you know, are a major factor and a major quality of life problem. There is a very extensive literature on yoga and its impact. Here's just one study that I think was very important, in particular because it was specifically done in a population that had not had previous exposure to yoga. This was an underserved patient population in Boston. So this, again, is not in the VA. This was done at Boston Medical Center. But it looked at 320 patients, diverse and predominantly low-income population, who had chronic low back pain, and they were randomized to either yoga classes, 12 weeks, or 15 physical therapy visits, or just an educational program. Basically, what they found is both the yoga and the physical therapy participants had a very significant reduction in pain over the course of the 12 weeks, and a significant reduction in pain medication. And then very importantly, what they found is that the improvements in the yoga and physical therapy groups were maintained at 1 year. So both of these strategies worked, and they continued to work for a year, and there were very, very few adverse effects. So what this takes us, where this takes us is the idea that, I mean, you might say, well, why don't we just give everybody physical therapy? That's already available and it works. Well, physical therapy, not everybody wants to do physical therapy, and not everybody will comply in the long run with the recommendations of the physical therapist. Some people will do better with the yoga approach, perhaps different style, perhaps more of a mental or psychological centering impact, as we know. But whatever it is, it's very important to have more than just one tool in your toolbox in treating whatever problem you are looking to approach. So here's just a wonderful example for how yoga really has been shown now to be just as effective as standard therapy for the treatment of low back pain. Another therapy that has become very popular in the VA is Tai Chi. As people know, Tai Chi derives from a martial art originally, but now has evolved into a very widely used self-care and self-management approach. Has many known benefits, improving balance in older people, preventing falls, improving quality of life, and also helping with pain management. And a really wonderful thing about Tai Chi is can also be delivered virtually. And we've seen the same kind of very substantial uptake of Tai Chi during the pandemic, of people signing on for classes and doing them at home. So alongside yoga, this has become a very important tool, and very importantly, a tool that people can learn how to use for themselves in order to prevent back pain and prevent, ideally, future episodes of other pain and injury. So I want to share just a little bit about some of the outcomes we have seen in the VA from this whole health experiment. And important to say that whole health includes complementary therapies like yoga and acupuncture, but it also includes a number of other services, including health coaching, including peer support groups, And so it's a bigger and wider approach in some ways than just applying the specific therapies. But the therapies like yoga, like Tai Chi, like acupuncture are a very important component. So we did a very large study at 18 VA medical centers around the country. What happens when veterans with chronic pain have access to whole health treatment over the course of a year? And we found a number of very interesting things. We found that veterans who used whole health had a very rapid and significant drop in their opioid requirements as opposed to people who did not use it. We also found that they had a greater sense of engagement and involvement in their healthcare. We found that they had improvement in their sense of meaning and purpose in life, which is very significant because, as you probably know, veteran suicide is a very great concern in the States. It's very common, and helping people reestablish meaning and purpose in their life is very critical. We also found significant improvements in perceived stress and associated improvements in overall well-being. So veterans at these 18 medical centers, and this was done on a sample of roughly 3,200 people, really improved in a number of different domains in terms of what their health status was like. Here's a diagram of what happened with the opioid utilization. So you can see on the left, so the VA, like many other health systems, has been working for quite a while to reduce opioid prescribing because of all the potential complications. So you can see that the standard population on the left in the black bar, which did not use any whole health, still had a decline of 11% in their average opioid dose. But then as you move across to the right, and those two right-hand columns, these are people who had 8 or more whole health visits. You can see that they had a drop of 38% in their average opioid dose. So 3.5 times the magnitude of decrease in opioid utilization in people who chose to use the whole health system. And I think it's very important to say that a lot of this has to do with teaching people or helping people learn how to develop their own skills to manage their own health problems so that they're not always depending on going to the doctor, going to their healthcare giver, and asking that person to provide a solution. And something like yoga is a great example. Once you learn the yoga skills, if you build them into your life, you continue to use them, you can actually avoid a lot of problems and take care of them yourself without needing to reach out to your healthcare provider for help. One additional resource I want to share, again, because this has just become so useful during a pandemic, is that we built out a set of resources for veterans initially, but these are actually available to everyone on how to learn self-care strategies. And this was called the #LiveWholeHealth campaign. And it consists of a number of brief videos, basically, that show people how to practice certain skills that can help them take care of themselves. There are about 65 of these online and accessible now. There are Tai Chi videos, there are yoga videos, including chair yoga and yoga for people with limited mobility. There are acupressure videos for people to learn how to do acupressure points on themselves or for a family member to learn. And there are a number of mind-body approaches like guided imagery, mindfulness, other kinds of meditation. So this is a great resource, and I would really encourage you to just go ahead and Google #LiveWholeHealth and take a look at some of the resources that are available, because I think it really pushes forward the idea that a lot of integrative health is about empowering patients to develop their own skills and things they can do at home and things they can do with their family to help them stay healthy. And this is just to emphasize that this is a new horizon. This is a transition in how healthcare systems have looked at their job. So a lot of our previous approach was, okay, we're going to identify what diseases you have. We're going to try to fix them. Mostly we're going to use medications and surgery. And then if we can't fix you with those approaches, well, we'll see you later. And I think the idea is that we are able to incorporate this idea of integrative health, and particularly the idea of helping patients learn skills where they can manage on their own. We are really on the right road and going in the right direction. And I hope and I believe that VA is sort of setting a new standard for how we can do that by using things like yoga, Tai Chi, meditation, to really empower people to take charge of their own health, prevent future problems, and live a healthier life. So I hope this has been useful, and I hope you enjoy the rest of the conference. Thank you very much.
Thank you, Dr. Kligler. That was wonderful to hear about the VA Whole Health Program. So let me move on to the next speaker, Dr. Marianne Levy. Dr. Marianne Levy is Professor and Associate Dean of the School of Public Health at the University of Memphis. As a registered dietitian and fellow of the Academy of Nutrition and Dietetics, she has spearheaded numerous initiatives to promote health equity, provide environmental support for healthy lifestyles, and enhance eco-responsibility. Since 2005, she has served as NIH Special Emphasis Review Panels for the National Institute for Minority Health. Dr. Levy received the Ruby R. Wharton Outstanding Women Award for Race Relations and has been recognized with teaching awards from the University of Memphis and the Academy of Nutrition and Dietetics. Dr. Levy has held several leadership posts, including president of the Tennessee Public Health Association. She served on the board of editors of the Journal of the Academy of Nutrition and Dietetics, and currently serves on the governing council of the American Public Health Association. In 2017, she received the Doris Payne Distinguished Service Award from the Tennessee Public Health Association in recognition of her contribution to the association over a period of several years. Over to you, Dr. Marianne Levy.
Thank you. Thank you very much. Namaste to all. I'm going to share my screen. And see if I can find my PowerPoint. Let's see. Whoops. I think I'm having difficulty sharing my screen. So Sagar, if you could share it. I see it now. Thank you very much. I would like to thank you very much for inviting me to be here. I'm the Associate Dean of the School of Public Health at the University of Memphis, and I'd like to share with you some of the public health perspectives related to yoga. Next slide, please. So in public health, we focus very much on health equity, access to health care, access to quality of life for everyone, regardless of station in life or who they are. So we also have a population approach as opposed to clinical medicine. Clinical medicine focuses on the individuals and restores them to health. In public health, we take a population health approach to focus on communities, cities, states, nations, the globe. So we have a wider view and a larger impact. And part of that addresses what we call social determinants of health. Access to healthcare is responsible for maybe 10% of a person's health, but 90% has to do with their environment, their lifestyle patterns, and also social determinants such as whether they live in poverty, the type of education they have, if they have transportation, if they have a job, things that affect their quality of life. So we focus on that as well. And we primarily focus on prevention, preventing disease before it starts. This involves lifestyle patterns such as healthy eating, healthy exercise, tobacco control. But instead of restoring health, We want to maintain optimal health and prevent disease from occurring. Next slide, please. So one of the factors that contribute to disease is stress. When a person is stressed, cortisol is produced. That's an antagonist to insulin. It breaks down glycogen. Glucose is released into the bloodstream, and it increases your heart rate, breathing, the muscles contract, so it allows the fight or flight syndrome to take place, and which is fine for short-term stress. But if a person has long-term stress, chronic stress in their life every day, such as a lot of people who are underserved, vulnerable populations, it can lead to hyperglycemia, can lead to hypertension, which in turn leads to cardiovascular disease, stroke, diabetes, certain other chronic diseases. Next slide. So this is just a diagram, a picture of the stress response. Next slide. So the health benefits of yoga, according to NIH, are to relieve stress, help overweight, obese people gradually lose weight, to help people quit smoking, managing anxiety or depressive symptoms of ordinary life patterns, and help manage chronic disease symptoms and improve quality of life. Next slide. So in public health, we have two types of diseases: chronic diseases, lifestyle diseases, diabetes, hypertension, cardiovascular disease that take a lifetime to build up. And we also have infectious diseases such as COVID-19 that are transferable and transmitted from person to person throughout society. So in both cases, they can stress management is necessary. Mental and emotional health is affected. For chronic diseases, obesity reduction is desirable, and tobacco control, because mainly with the chronic diseases, lifestyles such as healthy eating, physical activity, and tobacco control are the big three that are the factors that build up to promote obesity and also the chronic diseases. But stress management and emotional health is also important in infectious diseases such as COVID-19. CDC did a study of public health workers in the field and found that 53% of them experienced inordinate amounts of stress. So we think of stress for chronic disease, but also with infectious disease, stress can be a large factor as well. Next slide. So in terms of stress management, in 2020, there was a review of 12 studies that found beneficial effects for perceived stress. In 2014, over 1,000 people, there were studies involving over 1,000 people, and 12 of the 17 studies showed improved physical or psychological measures related to stress. So yoga is very beneficial in terms of stress reduction. Next slide, please. Also, with mental and emotional health, studies with over 1,000 individuals have shown that with yoga comes improved resilience and improved general well-being. Next slide. And on a population level with young adults, yoga has been associated with healthy eating, improved physical activity, and the habits that were supported through greater mindfulness, eating healthier, and being around like-minded individuals. People who practice yoga tended to be very similar in terms of their mindset, their perspective, and wanting to be healthier. So the social support that was involved with being associated with people who practice yoga benefited also with healthy eating as well. Next slide. With weight control, there were 17 yoga-based weight control programs that were reviewed in this study, and they found not drastic weight reduction, but gradual, moderate reductions in weight, and that's actually what you want in terms of weight control. The elements were longer and more frequent yoga sessions, a longer program duration, dietary component, if people could stay a full weekend before beginning the program, larger number of elements of yoga, and home practice. These were the elements that were promoted successful weight reduction. Next slide. And then a review of 10 studies of yoga in overweight and obese individuals saw a reduction in body mass index, which is a measure of height and weight. So it actually found that there was weight reduction with practice of yoga. Next slide. Tobacco control. They did a study comparing with counseling, but it was augmented. Half the people were augmented with tobacco control. With wellness classes. Let's see. Yoga versus wellness classes in addition to weekly counseling. And the yoga group was 37% more likely to quit by the end of the program at 8 weeks. However, at 6 months post-treatment, there was no difference. So another example of the short-term effect of yoga, in a 2020 study, after just a single yoga session, cigarette cravings were reduced. So you see the immediate effects. They're not necessarily sustained, but perhaps if you practice yoga continually, that can be effective. Next slide. A review of 23 studies of people with depressive symptoms. They weren't diagnosed with depression, but they had symptoms. The symptoms were reduced in 14 of the 23 studies. However, a study of PTSD found that only low quality evidence of benefit. So the take home message is yoga may be helpful with ordinary anxiety or depression that people feel a routine part of their lives, but not for mental health problems. Next slide, please. Cancer has also shown, there were 138 studies with over 10,000 individuals, mainly breast cancer patients, showed improved physical and psychological symptoms and increased quality of life. With chronic obstructive pulmonary disease, 10 studies showed increased physical activity, lung function, and improved quality of life. Stress management was improved with HIV patients, and small improvements in symptoms and quality of life for asthma patients. Next slide. So looking at the impact of public health, we want to look at the numbers of people who are affected by these diseases. In terms of obesity, 1 in 5 adults worldwide are expected to be obese by 2025. The United States spends $190 billion each year on treating outcomes related to obesity, health issues related to obesity. Globally, the cost in US dollars is $990 billion a year. So think about all the other, if we didn't have to spend money on those issues, on treating the side effects or the results of obesity, think what other good things we could do with that money on improving health, on air quality, water quality, food, access to food for people, education. Think of what we could do if we don't have to funnel that money into the ramifications of obesity. Next slide. Cancer, an estimated 19 million new cases and 10 million cancer deaths worldwide. HIV, globally, 38 million people with HIV, AIDS in 2019, mainly adults. Next slide. Asthma affects 300 million individuals worldwide and 250,000 asthma deaths each year. Next slide. And tobacco. The global total economic cost of smoking in US dollars is $1,436 billion. That's just an inordinate amount of money wasted in that aspect. In the United States, U.S., the smoking-related illness costs more than $300 billion each year, includes $5.6 billion in lost productivity due to secondhand smoke exposure. Next slide. So we have a great potential to improve public health. Most of the studies were done with Caucasian, highly educated women who had above average economic standards, were above average socioeconomic scale. So the challenge for us is to extend this to people, underserved individuals who have a greater preponderance of chronic diseases and chronic disease risk. So thank you for inviting me today. And thank you. And next slide, I'm happy to answer any questions later on. Thank you.
Dr. Levy, there is indeed great potential to improve public health through yoga. Let me introduce our next speaker, Dr. Indranil Basure. Dr. Basure is a staff cardiologist and cardiac electrophysiologist and the director of cardiovascular research at the Memphis Veterans Medical Center in Tennessee, USA. He's also the visiting professor of cardiology and head of integrative cardiology at the All India Institute of Medical Sciences, Rishikesh in India. And Dr. Basure has been meditating since the age of 6, and he has learned Kriya Yoga from multiple Himalayan gurus, and he's also trained in Vipassana. He's the founder chairman of American Academy of Yoga and Meditation, an organization of physicians, scientists, researchers who work on scientific validation of yoga and meditation and hold regular international conferences worldwide where the latest research is presented by world's top authorities. Now over to you, Dr. Basure, to give your introductory comment.
Thank you very much, Dr. Mahadevan, for the extremely gracious introduction. I really appreciate that. I'm not sure if I really qualify for that, but thank you very much. So it's important to understand why are we so much crazy with communicable heart diseases, non-communicable heart diseases, or chronic diseases in general. Take for the case of United States of America. United States of America spends $1.5 trillion, that is 75% of all money, on treating the so-called chronic diseases or non-communicable diseases. And if I take my specialty, things are even worse, that is cardiovascular diseases. America for a long time has been the cardiovascular capital of the world. It has one of the highest amount of death due to cardiac disease. Slowly, other countries like India is taking over. Based on 2015 statistics that's there on the CDC, we have over 700,000 people dying every year. By the time we started this program, 30, 40 minutes back, at least every 2 minutes somebody would have died somewhere in America due to what is known as sudden cardiac death. And it's important to remember that despite development and massive improvement in modern science and medicine in general, and cardiology in particular, not much has changed on the prevalence of cardiovascular disease, the number of deaths from cardiovascular disease. While heart attack are different types, there's something called STEMI, non-STEMI, without going into the details. While one of them has decreased, the other has remained almost same, which says that something else is going on which we are missing, and that's where we need to bring in yoga. So what are we missing? So it's amply evident that all the chronic non-communicable disease like hypertension, diabetes, heart attack, all lead from what we know is inflammation inside the body. And what causes inflammation inside the body? Things that cause inflammation inside the body is your mental state. If you're depressed, if you're anxious, if you have stress, your body releases a bunch of inflammatory markers that causes inflammation. And this inflammation, when it happens within the heart, you get a heart attack. When it happens in your brain, you get a stroke. When it happens in your peripheral artery disease, when it happens in, say, in your legs or in other parts of the body. So the name looks different, but it's the same devil with the different names. And that constitute almost twice the number of death in this planet from the second largest killer, that is cancer. And the good and the bad news is, the good news is that this can be controlled if we can control our mental state, which is obviously easier said than done. And but having said that, there has been a lot of study in the past couple of years that there's a form of heart disease which some countries are facing, say for example India, which is known as malignant heart disease. So what does that mean? That means in the standard medical teaching, most people get heart disease after they are 50s, or maybe around when they are 50s or more than 50s. And as you age, you're 60, 65 in males or in females, mostly after they are post-menopausal, they tend to get heart disease. But with changes in lifestyle and other things, now we are finding much younger people having that. In the last couple of years, we had over 20 million Americans who are below 50, above 20 years of age, who had coronary artery disease, and they have active heart disease. What is almost unknown in medical books, we see that rampantly today. A girl 30 years old has triple or quadruple bypass surgeries, which is unthinkable even 20 years back. Most of the medical books used to say that the epidemiology of heart disease is age. So if you're 50, 60, that's when your risk increases. But we don't see that to be true today. So it's important to understand that this massive increase in cardiovascular disease has got a couple of reasons. One is, how much are we preventing? How much are we spending as far as preventive medicine is concerned? So let's take the example of two countries. One is United States of America, another is Finland. How much does Finland spend on healthcare? It spends almost 40 times less than America on healthcare. And where is the role of Finland in total health delivery and the quality of healthcare, and where is America? Finland is around 20th, America is around 23rd to 25th. So despite spending 40 times more than a country like Finland, we have worse healthcare than that small country. And why is that? The reason is 99% of the Medicare and Medicaid money, that is the federal government money, is spent on not on preventive healthcare, but to treat actual acute diseases. So if I give you a similar situation, there's no use having multiple phones to call 911 when your house is already burning. You need to make arrangements so that your house doesn't burn in the first place. So that's exactly what is the story with healthcare in America. We have all the preparations, all the world's topmost technology to treat when our house is already burning, when somebody has a heart attack, is being moved to the hospital. But we don't spend enough. We spend way less than what we need to spend to prevent that heart attack in the first place, to prevent that stroke in the first place, to prevent that cancer in the first place. One patient, if we treat less, just one patient less with HIV, we save $400,000. Imagine the amount of money that is saved. So prevention is very important. Unfortunately, we are one of those places where prevention has never been the predominant mode of our policy. Our policy has also always been trying to take care of acute care. Now, that's the reason why we see this sort of a problem. Take the case for India. Almost similar is the story. A, we have an aging population. B, we have something called a malignant heart disease, where an 18-year-old can have triple bypass surgery. And there are multiple papers on that. And that's for different reasons. Number one is obviously most Indians have a smaller blood vessel size, so it's easy to get blocked and have a heart attack. Number two, there is a lot of stress. Now we have pandemic, and because of pandemic, as you know, the number of cardiac deaths is way more in US due to heart disease than has ever been in the history of America. Since World War II, the approximate living span of an American for the first time in history has actually decreased. It has always been increasing. People live longer in the US because of good medical care and other things. but for the first time, it has decreased since World War II. So anything like this pandemic, which actually adds fuel to the fire, worsens the situation just because you do not have enough preventive medicine to buttress off the negative factors that comes into play when you have such massive pandemics. So, with malignant heart disease on board, with millions of dollars being spent on cardiac disease, on cardiac transplant, every year America has to treat from taxpayers' money 1 million heart failure admissions. And some of the people who get admitted are readmitted as many as 4 to 5 times within the span of one small year. So, and all of these, and again, I repeat that all of these is completely preventive. So it's important to understand how we do that. So going back to the understanding of the etiology of heart disease and etiology of a lot of chronic diseases, it's important to understand that when you have depression, anxiety in the brain, that activates the sympathetic nervous system. And when the sympathetic nervous system is activated, what happens is a deluge, a cascade of highly inflammatory but powerful markers are released, called interleukin 6 and a bunch of them. I don't want to name all of them. Tumor necrosis factor, to make it more simple. And what do these do? These are the ones which cause inflammation in your blood vessels. And that's how a 30-year-old guy with inflammation inside his heart can have heart disease. And then when you have heart disease, you block one of the many blood vessels supplying nutrition to the heart, you get a severe heart attack. When you get a severe heart attack, you get heart failure. When you get heart failure, that's how the vicious cycle starts. You get more heart failure and you get more admission, more heart failure, and the whole story continues unstoppingly till you do something not to treat the heart failure or not to treat the heart attack, but actually change the basis of that. So what is the basis of that? Giving them stents, giving them bypass surgery, which costs millions of dollars? No. Because if you give them a stent or if you give them bypass surgery, what you're actually doing is you're just preventing them from dying after that acute attack. But you're not killing the disease forever. You need to kill the source of the disease. The source of these diseases are unfortunately not in the heart. The source of these diseases is somewhere completely different. The source of these diseases are in the brain, in your endocrine system, which produces tons of dangerous chemicals like interleukin, like adrenaline, like noradrenaline, that makes your heart go fast and die. And that's why every 2 minutes somebody in America dies because of sudden cardiac death, where your heart goes at 100 to 200 beats per minute and you die out of it. That's why you can have disease like atrial fibrillation. That's why you can have recurrent heart failure with multiple admissions, and every admission worsens your chance of survival. So we need to change this mental condition. We need to change our brain. Can we change our brain? Yes. Last 2000 years, we thought we could not. But in the last 10, 15 years, thanks to development of MRI, more research on yoga, functional MRIs, CT scan, using radioactive ligand inside the brain, we now know that we can actually completely change our brain circuits. So instead of having a chemical called dopamine, which causes anxiety, stress inside your brain, just 4 weeks of yoga practice can cause enough neuroplasticity for you to produce more serotonin, which makes you more happier, decreases stress, decreases those interleukin 6 and other inflammatory markers released in your blood that's liable to give you a heart attack. So it's possible to do through this. Not only that, think of the thousands of people and the millions of dollars we spend for nursing home cost on people who are 80, 85 years old. Almost 30 to 35% of people in developed countries like the United States of America languish in nursing home. They don't know even their name, leave alone where their family lives, leave alone who their wife is, who their son is, who their daughter is, or even where they are presently staying. They have no clue what day or date it is. Somebody will still tell you that possibly George Washington is the president of America. So this condition, and as we know, modern medicine has very little to offer. There are 3 medications which hardly work. And one medication, as you know, has been in the news. It costs almost $56,000. It was recently approved by the FDA. But a lot of specialists are so much against its approval that almost 3 people from the FDA board that approved it resigned in protest because FDA approved that medicine with very little proof that it works. Now, we know that as back as 2005, Sarah Laser from Mass General Hospital and Harvard Medical School showed that your brain actually grows if you practice meditation. Your brain grows, which is a new finding that we never ever knew. So when your brain grows, you don't need to have medications. You don't need to have $56,000 to spend on a drug whose effect you don't even know if it's as good as a placebo or just a useless drug you're taking just because FDA has approved it and because the medical company wants to make money out of you. So, and this is since Sarah Laser's initial paper, there's been over 89 papers showing the development of different parts of the brain due to practice of meditation. There's brain growth. And similarly, there's also reduction in some of the other places inside the brain, which is responsible for negative emotions, like the amygdala. There's a study from Hungary where they took a bunch of young kids who had their parents die when they were super young, and they were brought in foster homes with history of a lot of abuse. So when they were first brought for meditation, they were having huge amygdala, a part of the basal brain that we share with our ancestors, that is the dinosaurs, or even with snakes and reptiles. That's called the reptilian brain. And these kids, when they were taught meditation, they found that the function of the amygdala decreased. The amygdala did not light up anymore when they did SPECT scanning of the brain. And in fact, in one of the Wisconsin Center for Research on Meditation, where they did brain scanning on a large number of Hindu and Buddhist monks who had 15 to 20 years of meditation, they found that their amygdala hardly ever lighted up. So not only can you improve the positive thinking in your brain and decrease inflammation in your body and prevent yourself from having hypertension, blood pressure, high blood pressure, and heart attack, but you can also decrease the negative emotion that propitiates all this, that causes you to get heart disease, that causes you to have poor sugar control and blood sugar or diabetes mellitus, that prevents you, that makes you to get inflammation in your heart and kills you because of having a massive heart attack. So it's important to understand that to make US or India or the other countries where preventive medicine or public health parameters, as Dr. Levy pointed out, are not given precedence, but acute care is given precedence, you will continue to have more and more people being killed because of chronic diseases. Now, it's not surprising that 67 to 70% of death all over the world, it doesn't matter which country you talk about, whether it's America, whether it's India, whether it's Canada, whether it's Spain, they die because of chronic diseases. So chronic diseases is the main killer. Why? Because we have learned to save life with acute diseases. Because of massive development of medical sciences, we can prevent sudden cardiac death. We can prevent a bunch of acute death after heart attack because of stenting, because of bypass. There are a lot of chemotherapies that prolongs life in cancer, acute cancer conditions. But there's very little when chronic disease comes into play. And that's why most institutions, like as you heard Dr. Kligler say, in the VA, there's an aggressive thought process to introduce integrative care and yoga. And you have thousands of people with yoga who practice yoga at the VA. So from our side, we have two important things that we have been trying to work on. One is, as you know, I work in a VA and we have a large amount of population, not large, super large amount of population with all the risk factors, whether they have tobacco smoking, they have hyperlipidemia, they have blood sugar. And the worst thing is the blood sugar is poorly controlled because quite a few of them may not be compliant. And that's true for a lot of people, even outside the VA also, general population in the US. So one of our projects is to use artificial intelligence to find out who among these people are liable to get a heart attack and predict that artificial intelligence using things like number of breaths they are taking, their heart rate variability, which is a marker of how healthy your heart is, a couple of other blood markers like interleukin-6 and other things. And based on that prediction, we'll offer them 6 to 12 weeks of yoga, which includes meditation. And that's another important part to bring in that, unfortunately, in America, yoga means physical exercise. Physical exercise, unfortunately, is only 2 to 5% of yoga. So when I have my patient coming and telling me, hey, Dr. Basure, after I met you, I've been doing yoga regularly. I said, oh, cool. What did you do? What do you do? When do you do yoga? He said, well, Dr. Basuri, every week I go at least 5 days to the gym and do yoga from 5 to 6 p.m. So that's very important to understand. Yoga is not Pilates. Yoga is not making up your muscles. So you cannot do yoga for an hour out of 24 hours. You got to do yoga 24/7, 365. Now, what does that mean? That means a complete change in lifestyle. You have to live in the present. You have to be mindful, which in yoga is called dharana. Today, the word mindfulness has got popular because a lot of people talks about mindfulness, but we know mindfulness for like 10,000 years. In yoga, there are 8 steps. One is dharana. First is pratyahara, which is pre-mindfulness. Pratyahara means taking your senses off the physical reality. So if I have a problem going on with something, I try to take my mind off it. Second is dharana, which is mindfulness. I try to concentrate on my breath. I try to concentrate on my thoughts. There are multiple ways to do mindfulness. And then I do meditation. Before that, you can do breathing technique. Like, for example, pranayama. If you do left nostril breathing, you can immediately bring down your sympathetic discharges and increase your parasympathetic discharge. And you know what parasympathetic discharges do? It brings down your blood pressure, it brings down your heart rate, it makes you stronger cardiologically, you live a longer life. So yoga is the only known powerful means by which you can bring down your sympathetic drive. There is no known drugs. There are complex surgeries which nobody's used because they have high mortality. No, all the drugs have a lot of side effects if you use them to block your sympathetic system. And most of the drugs don't work all over the body, they work only locally. So if you want to bring down your sympathetic discharge, if you want to bring down your chance of getting older faster, if you want to bring down your chance of having heart attack, cancer, stroke, the only way is to bring down your sympathetic drive and increase parasympathetic drive. And the easiest way to do it is 10 minutes of yoga practice, which includes meditation, and then trying to be mindful throughout the day, being non-judgmental and being in the present. Because as many people have said, you can cry about your past, you can flood your house with your cries, your past don't change. You can plan for your future, you can daydream, that may or may not give you the future you want, but you're in complete control of your present. And nobody on this earth or even in heaven can snatch your present. So you have to make the present the best. And the best way to do that, as Buddha once had said, that staying on earth, pain is mandatory, but suffering is optional. Even the greatest beings on earth, starting from Jesus Christ to everybody you name, while on earth, they didn't have a very good life. I mean, we know what happened. Many of the rishis, many of the saints had cancers, some were killed because they wanted to propagate peace, whereas other people wanted war. So staying on earth has its own problems. So if you stay on earth like you and me, and I don't think we have much of an option on that, pain is mandatory. But suffering is optional, because if you are mindful, you don't get the suffering. And why is that important? Because every time you think of those things, you think of suffering or you think of negative thoughts, all that happens is that body brings out tons of these material that actually kills you, and it leads to heart diseases, leads to cancers. So the only way to prevent it is not by treating that heart disease, because remember, heart disease itself is a tertiary phenomena. The cancer is a tertiary phenomena after 15 to 20 years of stress. So the primary treatment should be where it starts, and it starts in the brain, it starts in your thought, it starts in your mind. I think I'll stop there, and I think we have time for questions now.
Sure. Thank you, Dr. Basure. So it looks like, I think, preventive healthcare should be a big part of integrative healthcare, and we need to have big investments in these areas. So let me quickly go on to some of the questions that have been coming through. I'll ask both of you to address. So firstly, how much is yoga part of your current healthcare ecosystem? And is yoga incorporated in treatment protocols for various conditions that you are actually treating and following within your respective healthcare ecosystem. Unfortunately, Dr. Kligler could not be here for the Q&A session, so I will just address these questions to Dr. Basure and Dr. Levy. Please, who wants to go first?
I can go first. So yeah, as I said, we are working on 2 projects in the VA where we are going to use yoga. I'm also working on a large number of the first responders. Every Tuesday we have a meditation session for the employees, because as you know, thousands of physicians have died, physicians, nurses, frontline workers due to COVID. And there's a lot of stress. There's something called PTSD, because post-traumatic stress disorders. Doctors have been and nurses have been working overtime because of dearth of health personnel while treating COVID patients. So I've started a meditation program in the VA where employees do meditation, guided meditation every 15 minutes, every 1 day a week, and after every 4 weeks we have a 1 hour session where people from other VAs join in, and we do online teaching of meditation. Our hope is, again, it's a hope, that we will control COVID enough so that by the end of July or August, we will continue to do the tele session, but we will start physical sessions inside the VA where all the frontline workers can assemble in a large hall, maintaining appropriate distance, and be actually taught meditation for this. Answering the second part of your question, unfortunately, we haven't started. I mean, we are not even toddlers, not even infant. We haven't even started incorporating yoga into regular clinical practice. As you know, we wrote down the guidelines on behalf of American Heart Association on 2017, but most places have still not started. And as you correctly said, what we need to have is, okay, you got to stop smoking, you got to take statins for hyperlipidemia, you got to take this for this, that for that. And equally important should be, you should start do this yoga to prevent stress. And that would be the day I'll be most happy, when we can actually incorporate that in our prescription, because yoga should be the first medicine, not X statin and this. Every medicine has their own side effects. And yoga is the only medicine that you don't have to go to a doctor. You don't have to pay millions of dollars to a pharmaceutical company. You don't have to be at the clutches of other people. I mean, you just do in your own sofa, sitting at your own sweet time. So unfortunately, that has not come. I hope a day will be there before I die when we'll be able to do that.
Thank you, Dr. Basure. Dr. Levy, please.
In the School of Public Health, we don't have any clinics. So we don't really have any yoga that is present, in the University of Memphis. We do have a health center, and we're going to suggest that yoga is a large part of it. And I agree with Dr. Basure. He gave an excellent presentation about the value of yoga and the fact that it's cost effective. It doesn't cost anything. There's no side effects, and it's effective in reducing stress and helping you just cope and become a more human. So.
And on a related question, I think, you are in the School of Public Health, and one Dr. Dinesh Patel is asking, what integrative medicine modalities could be used for preventive healthcare, or from a public health perspective, in you're looking at preventive aspects of all these chronic conditions and lifestyle disorders. And the next related question is, how much time and how long would you recommend if you're saying somebody should be doing yoga? Is it you do every day, every other day? Is there some protocols or any studies that suggest what is a good plan or a protocol for that?
I can take the first part of it, and I'll defer to Dr. Basure for the second. Mm-hmm. In terms of the lifestyle changes, the physical activity, the healthy eating, not doing tobacco, and also the meditation, all combines, even the things that they do at the VA, all the Tai Chi, all those mechanisms are very healthy and very effective in promoting a healthy lifestyle and reducing chronic disease risk that Dr. Basure talked about. And I'll defer to him about the amount and the timing of the yoga that he would recommend.
So thanks, Dr. Levy. So there's been a bunch of studies on this. I'll just tell a couple of studies. So there's one study on decreasing hyperlipidemia, and that study they used 5 days, 20 minutes yoga session, at least 10 to 15 minutes of meditation. There are a couple of studies. Once the shortest was 4 weeks, and the longest was 12 weeks, and in that they found. So long story short, between 10 to 15 minutes every day, which includes meditation, and maybe 10 to 15 minutes of physical yoga, that is asana. So totally not more than 20 to 30 minutes, not a long time. If you practice every day, should be good enough to bring down a couple of things. Number one, better control of hypertension. Like there have been people on 3 drugs, they have come down to 2 drugs. Better control of hyperlipidemia. Better compliance to medication, which is even more important. You have a lot of people on 16 different medications, half of them they don't take. Number one, you can bring that down, that 16 number of medications to 6 maybe, or 8. And on top of that, when you're more compliant, you're more healthy. You get more compliant. So that has been the study. In cancer, it's the same story. Most cancer chemotherapy-induced side effects have gone down as little as within 4 weeks of meditation practice. Dr. Cohen has got a huge number of papers on that from MD Anderson. And most people did not more than 30 minutes, that to 5 or 6 days a week. Most studies are between 6 to 5 days. There are few which are 7 days a week, but I know it's difficult to do on a weekend. Your family issues and other things going on. What I recommend as a cardiologist is not more than 5 days a week at least, and make sure you just don't spend your time doing physical yogas. Take some time to practice mindfulness, take some time to practice some meditation. You don't have to be Buddha the day one, but and I'll give you a very good study, and that's really interesting. They took a bunch of young kids, the college-going kids whose most important thing in life was maybe getting a good, handsome-looking boyfriend or a good-looking girlfriend and get the most flashy car in the market. That sort of kids, really real kids, just started going to colleges. They taught them meditation for less than 3.5 weeks. In 3.5 weeks, they found that they could go into pretty deep meditation. So that shows that human brain is very adaptable. And you don't have to be a Buddha or Jesus Christ from day one. You can just start practicing as you are, and you'll get benefits very quickly within 3 to 4 weeks. I hope that answers both your questions.
So it does. So roughly 15 to 30 minutes, 4 or 5 days a week, not just physical exercise or asana, but incorporate some breathing and meditation and mindfulness. I think we are running short. I'll go to maybe a last question, which is related to the topic of our whole webinar. So we all know that there needs to be more investment in integrative healthcare right now and in the future. But right now, how is the ecosystem within your organizations for investments in yoga and integrative medicine-related programs? Has there been an increase, decrease? What do you see the trend within your organizations?
We see the need for it. We don't have enough right now, but we see a need to work in the future, especially with underserved populations who can benefit the most.
Mm-hmm.
Yeah. As Dr. Kligler said, whole health is a big initiative in the VA, and almost every VA has it. And I think in the future, multiple institutions can get together, we're already collaborating with Dr. Levy, thanks to her support. Maybe with people like a totally clinical program like us, who don't have the knowledge of public health, like Dr. Levy has. Both of us can come together and do good. And that's where the core of scientific research is. You need multiple organizations to come together, each with their own specialty, their training, their backgrounds, to make the whole thing a success.
And one point I would like to add is that yoga and some of these integrative modalities need to be part of the teaching or education curriculum and students and medical students, residents, and so on, and even the staff, for example, in these organizations, should be given the opportunity to practice as part of their entire curriculum or work. And there are some programs in the VA where they are trying to incorporate these yoga programs for nurses and so on, in order to increase the adoption. So any closing thoughts before we close the webinar?
Thank you for the opportunity to be with you today.
Thank you very much. Appreciate that for having us. I think in the policymakers need to understand the importance of preventive care, and I think some medical school already started that. I've been approached by a couple of medical schools to write up a protocol for introducing at least 40 hours of the science of yoga to third year or fourth year medical student when they start their clinical medicine. But this needs to be there all over the world. I mean, every country needs it. Thank you for having me.
Thank you.
Thank you. Thank you for all the audience, to AYM and our host, Sagar, who I believe is 12 years old, right? Thank you all. Bye.
Thank you so much, Dr. Mahadevan ji. Yes, I am 14.
Oh, 14. Okay.
Yes, I am 14. What an amazing discussion this was. You all explained the different aspects of integrative healthcare so well. Dr. Kligler, I liked how you showed that yoga was the best alternative other than medications because it has no complications or bad effects. I also like your statement, meditation instead of medication, because it's so true. Dr. Levy, it was so fascinating to see the stress response diagram of our brain. And I also really liked how you listed the yoga in public health benefits. Dr. Basire, I liked how you gave the example of someone, how someone cannot call when their house is already burning. You have to have the preparations beforehand only. Once again, I would like to take this opportunity to tell you all thank you and how mesmerizing this discussion became because of you all. Once again, I would like to thank all of our viewers for joining us to this discussion. I would also like to thank our tech team, Gaurav ji and Janet ji, for making this webinar possible. Our next session will be Yoga for Cardiovascular Disease tonight at 7:30 CST and tomorrow 6 a.m. IST. I hope you all enjoyed this discussion today. Hope you all have a great rest of your day in the United States, and good night to those in India. Namaste.
Namaste.